joined now by Senate Majority Leader Mitch McConnell.
We've been up against COVID since May. We've had numerous hearings remotely with senators calling in remotely, occasionally witnesses. We can operate successfully in a COVID environment. The Senate's done that for quite some time. In fact, the current members who have a problem got it somewhere else, not here in the Senate. So we've been operating successfully with masking and social distancing.
What do we need? PPE!
Please sign the DPA for the PPE petition. See details at the end of this video.
We're going to continue to do that.
You just mentioned that those senators likely didn't get it there. Do you hold the White House at all responsible for this Rose Garden ceremony and some of the other behaviors that some people think have been too risky?
Well, we don't have to change any Senate rules to deal with this, either in the committee or on the floor. So no rules change are required whatsoever. I do think there have been risky behaviors in other areas, but not in the Senate.
So you're saying you think that the White House has taken too many risks?
Well, there's no question that some of the infections occurred elsewhere and not here. So what I'm telling you is since May, we have operated successfully here in the Senate. We know what we're doing. We're following the CDC guidelines, and we'll get the job done.
This is Wall Street Journal. Trump and his aides have long played down importance of face mask distancing right up until the hours before the president tested positive for coronavirus. He and his staff often dismissed or ignored public health safety precautions.
I just want to address one thing, because there was some criticism over him going to the Truman balcony and, waving and kind of showing the sign of strength.
By the way, while you say that, we've got the image up next to you of him standing at the balcony, and I'll ask you about just that, because there's another vantage point where the president, he had just taken off his mask, he stands at the balcony, and then you see a photographer quickly behind him. And when we were speaking to doctors earlier, they said, well, it's okay, he was standing alone. He wasn't. There was a photographer very close in proximity to a man who's been diagnosed with COVID-19 and is still very much sick with it.
The photographer is protecting the president from the photographer, but the president, we know he has the coronavirus. People should be wearing masks regardless, but the president is the one who has the coronavirus. He is a symptomatic carrier of a potentially deadly disease that is very contagious. This is just reckless to put people in this situation. There's other people around. I really don't get it. This breaks every protocol. At some point, it's becoming absurd.
He then goes back into the residence, but he has no mask, right? He's breathing, walking around, and there's a whole bunch of people around him.
It's unexplainable that the President of the United States would walk into that building with the enormous number of staff unmasked, shedding virus in the air in that building. It's really hard to understand how no one told him not to do that.
I learned so much about coronavirus, and one thing that's for certain, don't let it dominate you. Don't be afraid of it.
I just have to say, to all the over 100 to 208,000, I can't even talk, families that lost a loved one to this disease. You know how terrifying it can be. Not everyone's lucky enough to walk out of the hospital after 2 days, so we saw what this disease can do. So guess what? We are afraid. We are. I still am. And, I think about if I got as sick as Nick, little Elvis, he doesn't have his mom anymore. So I'm afraid.
Republican Senator Mitch McConnell is afraid of catching the coronavirus, and that's why he's been avoiding going to the White House since August 6th.
I can tell you, I haven't been to the White House since August the 6th. I personally didn't feel that they were approaching a protection from this illness in the same way that I thought was appropriate for the Senate. And the Senate has been operating in a way that I think has largely prevented contraction of this disease as we operate in the Senate. In other words, I think we've shown that we can function safely.
Now I'm better, and maybe I'm immune. I don't know.
This is the president's video message that is also getting a lot of headlines this morning.
Nobody that's a leader would not do what I did. And I know there's a risk, there's a danger, but that's okay.
Perhaps you can explain the messaging there as you try to point out the president's message there, his standing on the balcony, taking the mask off as a sign of strength. Isn't the best thing that we can do for this country to get rid of this virus and show that we can defeat it?
Absolutely. So the president's message there is clear.
The message I have for everybody is the same one I had in May. Since May the 1st, I've said wear your mask and practice social distancing. It's the only way that we know of to prevent the spread until we get a vaccine. And we practiced that in the Senate. Now, you've heard about other places that have had a different view, and they are, paying the price for it.
Does the president feel like he wants to change the messaging on the coronavirus or even make it more of a central issue of his campaign now that he's experienced it firsthand?
So I think it has been a central issue. We've said this is one of the most important things afflicting our country. And from the outset, he's been working round the clock to deliver PPE.
Listen, just to go back to your point about you think it has been a central issue, I feel like many people listening would push back on that and say, but what about the Rose Garden event, the lack of social distancing? Not to bring all that back up again, but that was the reality that we saw of the White House, the campaign, the no mask wearing. Is it fair to say that it was a central issue of the Trump campaign, the coronavirus? So this is an AP headline. White House staff Secret Service eye virus with fear and anger. The West Wing of the White House is a ghost town. And this is from the article. Nonetheless, the mood within the White House remains somber, with staff fearful that they may have been exposed to the virus as they confront a new reality. A work site that once seemed like a bubble of safety is anything but.
I would give Donald Trump a complete failing grade for the way in which he's handled the coronavirus. He's been criminally negligent since January. I called upon him to use the Defense Production Act to produce the PPE that would be necessary. He did not do it. So he's been criminally negligent all the way up until leaving the hospital and telling people not to be afraid of the coronavirus.
At least 1,000 U.S. healthcare workers have died from COVID-19 so far, most of whom had inadequate access to PPE. And still, more than 6 months later, some of the most essential pieces of protective gear, like N95 respirator masks, are in short supply.
We are seeing a lot of our healthcare workers come down with this illness.
After 9 other nurses in the same hospital came down with COVID-19, the nursing staff started protesting.
We're all saying the same thing. Give us our PPE.
What do we need? PPE!
We are demanding PPE so that we can protect ourselves and our families.
What do we need? PPE!
There has been a major disconnect in messaging from the White House and from what we're hearing from state and local governments and also doctors and nurses on the ground.
The medical supply chain remains fragile.
We're months into this pandemic, and we are looking around the country, and nurses and doctors still don't have enough personal protective equipment.
He doesn't believe that there are shortages still.
I can't answer your question why nurses are still saying that they don't have supplies, because that's not the picture I have.
Hospitals across the country are low on protective equipment.
He thinks that we have an adequate supply of personal protective equipment in this country for healthcare workers, and he wasn't sure why a doctor or nurse might say that they didn't have what they need. But just 2 weeks ago, a Government Accountability Office report came out that actually confirmed that there are persistent shortages.
A recent survey of nurses around the country found that 2/3 of them were still reusing N95 masks, more than half of them for 5 days or more.
It didn't need to be this way. This is an administration that had policies, procedures, tools, plans, checklists, advance warning, all of those things, and it appears to have used almost none of it. This is such a historical failure on so many levels.
The president says he's a wartime president. This is a war against his virus. He should act like a wartime president. He has been very slow to act on a whole range of things. For example, he still hasn't fully invoked the Defense Production Act, which I called for a while ago. He finally did with General Motors after a little roundabout in terms of building ventilators. What about the masks? He can do that by the Defense Production Act right now. He could have done it yesterday, a week ago, 3 weeks ago, 5 weeks ago. They're in short supply. And our first responders are literally risking and some losing their lives to try to help the American people.
What do we need?
PPE! We are demanding PPE so that we can protect ourselves and our families.
What do we need? PPE!